Just published May 5th, 2026, the Global Initiative for Asthma's newest guideline update on global strategy for asthma management and prevention. This update incorporates new evidence and recommendations related to acute asthma management, diagnosis, treatment strategies, and long-term asthma care across pediatric and adult populations. Several updates were made throughout the report, including updates related to flowcharts, treatment, inhaler technique, severe asthma, and patient assessment tools. In today's rapid update, we'll just be going over a summary of key changes that were added to this 2026 update. For the full guideline, make sure to check it out on guidelinecentral.com. Let's get started. Starting with the section on management of acute asthma in primary care and in acute care facilities. New flowcharts were developed for assessment, treatment, and follow-up across primary and acute care settings for children, adolescents, and adults. Multiple updates were made to standardize management, including updated flowcharts, providing recommendations for treatment and follow-up based on patient presentations, revisions on when oxygen should be supplemented, and what are recommended targets and thresholds. There were also updates on more conservative doses of short-acting beta-2 agonists, or SABA, for asthma exacerbations, and the addition of inhaled corticosteroids, or ICS-formoterol, in mild exacerbations. Information on inhaler technique was also included in flowcharts, emphasizing tidal breathing technique and shaking inhalers before administration. The importance of lung function measurement is also mentioned and recommended for all patients when appropriate, as well as before and after bronchodilator treatment to confirm asthma diagnosis. Additional emphasis was placed on discharge planning, follow-up exacerbations, and oral corticosteroids, or OCS, stewardship. Next, the section on diagnosis of asthma in adults, adolescents, and children 6 to 11 years. Updates to asthma diagnosis include a more simplified flowchart to assist with utility and clarity. Bronchodilator responsiveness criteria were also revised following new results from large datasets, which showed underdiagnosis of asthma. Moving on to the section on asthma treatment in children 6 to 11 years. For children 5 to 15 years, the CARE study showed that low-dose budesonide-formoterol reduced moderate severe exacerbations by almost half as compared to SABA alone. For the section on asthma treatment in adults and adolescents, updates for this section include ICS-SABA combined with anti-inflammatory, or AIR, therapy being added to step 1. It's also stated that ICS-formoterol remains as the preferred approach over SABA-based regimens. There was also an update regarding inhaler use limits or frequency, as well as updated evidence on long-acting muscarinic antagonists, or LAMAs, in step 5. Next, the section on severe asthma. Updates for this section include new biologic treatment options, including depemokimab and omalizumab. There was also expanded guidance on biologic selection through an updated severe asthma decision tree. For the section on inhaler technique, there was additional emphasis on techniques for tidal breathing and single breath with pressurized metered dose inhaler, or PMDI, and spacer, and emphasis on proper inhaler preparation, including shaking PMDIs before use. Next, the section on new tools for assessment of patients with asthma. Several tools were added or highlighted to support asthma assessment, including pediatric respiratory assessment measure, pediatric asthma impairment and risk questionnaire, and chronic airways assessment tests. And last, for the section on other updates, additional updates include revised effectiveness of COVID-19, RSV, and influenza vaccines, emerging data on glucagon-like peptide-1 receptor agonists and asthma outcomes, and updated inhaled medication dosing terminology. And there you have it. Make sure to check out the full guideline from the Global Initiative for Asthma and other related clinical decision support tools at guidelinecentral.com.